Across the country, kids are back to school and facing tough COVID restrictions. No vaccine is approved for children under the age of 12 yet. That means schools are relying on things like masks, social distancing, and ventilation to limit the spread of the virus.
It's an uphill battle. Across the nation, kids made up 29% of all COVID cases last week, and that number has been rising for weeks.
And we're seeing that rise right here in our state, too. In the first week of September, 593 kids under the age of 20 got the virus, according to state data. Let's take a closer look at those increasing numbers.
Now, cases among kids have been going up, and that's a concern.
Kids in elementary school cannot get a COVID-19 vaccine yet, putting them at most risk to catch the virus.
Honestly, my greatest fear is that my child will be hospitalized and I won't be able to be there.
State Representative Genevieve McDonald and her family, including two twins, 3-year-old girls, live in Stonington. She says she's been checking every day to see when a vaccine will be available for kids.
I don't want to see my child get sick, particularly with a virus that's unpredictable.
That's why the Maine Department of Education expects school districts to follow US CDC guidance. Require masks for everyone in schools, use 3-foot spacing in classrooms, vaccinate everyone eligible, and test frequently, like pooled testing.
We know that what schools did last year to help protect students and staff worked because our transmission was very, very, very low in schools.
The latest update from the Maine CDC shows COVID-19 outbreaks at 14 schools. In the first week of September, kids and teenagers under the age of 20 made up more than 27% of new cases. That means more than 1 in every 4 people who tested positive for COVID was younger than 20. That trend stayed on the same track in the last 6 days, too.
We hope that because of the quick and aggressive measures that schools have taken, these initial cases that were diagnosed and detected will be just that, initial cases, and not necessarily be fountains for transmission. But it's too early to tell.
Maine's education leaders are asking those who can get vaccinated to do so to protect the tiniest Mainers.
The lower the community transmission can be, the better off we'll be in schools as well.
And that's why parents like Genevieve hope a vaccine for kids will get approved soon. A new layer of defense for Maine's most vulnerable.
Knowing they have that extra layer of protection should they be exposed will bring me a tremendous sense of relief.